together for the Atlantic Current, the most recent issue. I'm talking today to Eduardo Haddad. He has been working on the COVID-19 crisis and the geography of discontents in the global south. So I will have the first question for you. In your paper, you mentioned the emergence of different post-COVID-19 geographies of discontents reinforced by pre-existing intra-urban and inter-regional disparities in the developing world. Do you have particular nations in mind? And if yes, which are the main differences between COVID-19 contamination and the consequences in Latin America and Africa?
Okay, thank you for the question. Thank you for having me here to discuss the chapter. Actually, my chapter is structured around the concept of geography of discontents. According to this concept, the context in which people live and work heavily shapes how they view the world and how they think about the challenges they face. In very heterogeneous countries, people view the world differently depending on where they live. The greater the levels of interregional inequality within a country, the greater the differences in public perceptions that tend to arise. So in the context of the COVID-19 pandemics, we see that the spread of the coronavirus in the global south is strongly related to social and spatial structural inequalities. So in different countries, and I don't have a specific country in mind, but we looked at different experiences in Latin America, what we saw is that specific geographies and structural features will absorb the shocks generated by coronavirus in different ways. So my argument in the chapter is that in the global south, given strong within-country inequalities, there is a higher potential to generate increasing discontentment in regions that are left behind.
You asked the question whether the spatial, you mentioned spatial shocks. You asked the questions whether the spatial shocks generated by the coronavirus would possibly cause increasing discontentment in specific geographies in developing countries or not, in area and social groups that have been left behind. Which regions do you focus on particularly? You just mentioned you don't have one in mind, but you certainly have one in mind, especially if you look about Brazil. And do you predict violent eruptions, even civil war in some countries, if the pandemic worsens or continues?
Okay. So let me give you some evidence-based examples to illustrate this point that I mentioned in the chapter. So in major metropolitan areas in Latin America, the patterns of outbreaks were not homogeneous. Lower income individuals living on the periphery of cities tended to be relatively more affected by the disease, and highly affected areas were usually far from richer neighborhoods. And I'll give you two concrete examples. So in Santiago metropolitan region in Chile, mortality rates in the poorest counties reached over 5 times those in the richest counties. In São Paulo, where I live, poor households, which tend to be on the outskirts of the metropolitan fringe, presented a much higher excess mortality rate. So given the available information, it's very likely that coronavirus has had a more intense effect on poor households in metropolitan areas in the global south. So this reflects their vulnerability to the pandemic, not only in sanitary terms, if you consider health inequities, but also economically. So in my chapter, I looked at impact studies for Brazil, Colombia, and Morocco, just to mention a few countries. And I concluded that the main takeaway from the regional and sectoral impacts was that the main losses were concentrated in the regions that most contribute to those countries' GDPs, which coincide with the most densely populated areas, and that the most affected sectors were labor and low intensive. An interesting finding from the results for Brazil and Colombia was that regional economic vulnerability to the COVID-19 pandemic was positively correlated with the share of informal workers in the region, the level of compliance with restrictions measures, and with adverse impacts in neighboring regions. Moreover, the greater the share of the public sector in the region's GDP, the lower its vulnerability, since public workers tended to be the least affected by the COVID-19 shocks. This problem may be reinforced now that vaccination is underway. Last week, we witnessed anti-government protests in Asunción in Paraguay to demand President Benitez's resignation due to the alleged poor handling of the COVID-19 pandemic. Such protests may spread across different countries, and they will definitely have potential impacts in future elections.
We have the same problems in Europe. We have problems of discontentment in Europe. Even if a government had good intentions and would fight the spread, but has no real chance to impose social distancing, they would be unable to deliver water or soap in some countries of Africa. How can the governments succeed in fighting adequately this kind of pandemic? They have no chance practically.
That's right. Yeah, I agree. I think this is one of the main challenges for countries in the global south that lack resources, not only to contain the spread of the virus, but also to mitigate its adverse effects. You have mentioned basic needs such as access to clean water, access to basic services in general, including water, housing, health, just to mention those directly related to the main strategies to fight the pandemic, are not evenly distributed within countries. Moreover, when you consider the more densely populated areas in the global south, we found huge inequalities within large urban agglomeration. I explored that in the chapter discussing that while agglomeration economies can be seen as one of the beneficial aspects of urbanization, there can be side effects associated with increasing intra-urban and inter-urban inequality. Mitigation strategies also face the challenge to deal with the spatial inequalities in the developing world. For instance, a large number of mitigation proposals we see relies on the use of mobile phones. Most of the tracing strategies require residents to be contacted by cell phones. In many countries where schools closed, governments implemented different distance learning IT strategies to mitigate the adverse effects on education. But how about kids without access to a proper device and those that live in regions with poor connectivity infrastructure? At the end of the day, what is true for developed and emerging countries is not equally true for poor countries, and especially for Africa, as you mentioned. So in the context of my chapter, poor regions tended to be left behind even more.
You mentioned Brazil, and then we have to mention Jair Bolsonaro, who publicly dismissed the risk associated with COVID-19 epidemic and advised, just like Donald Trump, against methods advanced by health authorities, like social distancing, I just mentioned. And despite nearly 300,000 deaths in Brazil, a large part of the society, it seems, are ignoring the danger and continue to support Bolsonaro. So it's not only a question of not having telephones or not having tracing capacities, but don't they understand? And the other question is, what can be done by global health authorities to stop these kind of leaders from misleading their citizens? Because after all, Brazil fails for a longer period of time to reduce its pandemic. Their neighbors continue to be threatened, and so will be the rest of the world, which means it doesn't help if Germany or if Morocco is able to contain wonderfully well its pandemic, if in Algeria there is no success, or if in Mali there is no activity. What do you do?
Oh, no, that's very true. in my opinion, global health authorities are doing their job, providing technical, science-based advice and clear recommendations on different aspects of the pandemic. The key point is how countries, as you observe, how these countries absorb the information, adapting it to their own realities so that they can fight the pandemic more effectively. And in this sense, the role of leaders, you mentioned Jair Bolsonaro, Donald Trump, the role of leaders is very important. You have, I mean, the two presidents that you mentioned, they're presidents of important nations who initially denied the risks associated with COVID-19. Their speech and their attitudes set the example to a large part of the population in the US and in Brazil, compromising the implementation of actions recommended by global health authorities. So going back to my chapter, this is reflected in already existing polarization spatial patterns, reinforcing them. I cited a study by colleagues in Brazil that shed light on how political leaders' words and actions have influenced people's behavior during the pandemic. In this study, they combined electoral information and geolocalized mobile phone data and found that after Brazil's president, Jair Bolsonaro, publicly and emphatically dismissed the risks associated with the COVID-19 pandemic and advised against isolation, the social distance measures taken by citizens in pro-government localities weakened compared to places where political support for the president was less strong. So if we look at the electoral map of the former presidential elections in Brazil, there is a clear regional divide that has been further reinforced by such actions.
Which does mean that we come to the final question there. It means Brazil may suffer for a long period of time, how do you say, consequences on the economy? Or do you foresee a quick recovery once large parts of the global community has been vaccinated? Will countries like Brazil suffer longer than the others?
Let's put that not specifically on Brazil, but let's think in a broader term, in Brazil included. I think vaccination is going to be key to the term world economic recovery, Latin American economic recovery, and Brazil's economic recovery. However, given that vaccination is not going to be homogeneous across countries, we may expect an economic recovery in global terms with widening north-south inequality. So that in the global south, within country recovery, will also tend to be uneven. So in my opinion, those regions that are more connected to global value chains will tend to recover faster. Moreover, in spite of different paces that countries and regions will follow towards recovery, it will be important to monitor winners and losers in the near future. From a geographical perspective, and this is the focus of my chapter, it's expected that the COVID-19 crisis will result in some long-standing change to the ways people and firms move and operate. So this could mean that factors that were clear advantages in the past, such as agglomeration and the possibility of unplanned interaction through face-to-face contacts, might operate differently in the context and aftermath of COVID-19. So I have mentioned the case of Paraguay that faced mass protests last week due to the imminent collapse of the health system and the lack of vaccines in the country. This is a clear manifestation of the reality that's present to different degrees, I might say, in different parts of the developing world. So one interesting way to proceed would be to examine what role the economic geography of post-COVID-19 recovery will play in future voting patterns. And of course, the path of economic recovery will play a prominent role in understanding these forthcoming voting patterns result.
But listening to you, your impression is also that we will deal with 2 or 3 or 4 different speeds of recovery of nations, if nations like Paraguay, or let's say nations in Southeast Asia, if in Africa, if they are not up to par, if they don't recover, if they don't have vaccinations, if they don't have vaccinations which are touching the larger part of their society, how can the rest of the world recuperate without being permanently in danger to be again touched by the virus and the pandemic?
Yeah, I mean, the world, given globalization, you're right that the world is very much integrated. But when you look within countries, there are regions that are more integrated than others. And in the global south, the regions that are part of the global chains that are going to be part of this broader economic recovery are usually regions that are less affected by the virus because they are basically natural resource rich regions that are outside the more populated areas that face stronger contamination. So actually, that's a very interesting question, because given the different levels of access to vaccines, if we assume richer nations are going to get broad vaccination faster, right? It's going to be interesting to see how those countries that are going to be left behind and regions within countries that are going to be left behind will generate a new pattern of the geography of the discontents across the world. So that remains to be seen, but that's a challenging question, not only for the developing world, but also to the developed nations that whose whose production chains that they made part of which they made part of, they need to find a solution to not to disrupt production across the world and provide a stronger economic recovery.
Mr. Haddad, thank you very much. Have a nice time wherever you are, and stay safe and protect yourself.
Okay, thank you, Helmut.
Thank you.
Nice talking to you. Bye.
Bye-bye.